be 121 ayes and 23 nays. HB 1805 is passed in engrossment.
And with that, the Texas House of Representatives today passed a bill extending the state's medical marijuana program to millions of Texans. Adam Bennett is live in the newsroom to explain what's included in the bill and the next steps needed for this to become law. Adam.
Well, Mia, the state's compassionate use program allows registered doctors to prescribe low-THC cannabis to patients with certain medical conditions. That list started with epilepsy in 2015 and has since grown to include cancer, post-traumatic stress disorder, and a handful of others. Well, now Republican State Representative Stephanie Click's House Bill 1805 would expand that list even further. It would add a condition that causes chronic pain for which a physician would otherwise prescribe an opioid. Also new to the list, a debilitating medical condition as designated by the state health department. Finally, this bill would change the definition of what qualifies as low-THC cannabis. Advocates who were at the Capitol today for the vote called HB 1805 a great bill that they say they're happy to see advance.
Representative Click has been the author of every change and the creation of the compassionate use program. And this is another important bill that will make this state-sanctioned program more accessible for Texas patients.
And James is optimistic that Representative Click's success on past medical cannabis expansion bills will continue this legislative session. Meanwhile, she says Representative Click is working with Lieutenant Governor Dan Patrick and senators to craft a bill that can pass in the Texas Senate. That's where this bill is headed next after one final reading in the House tomorrow, which is usually just a formality.